You are watching the Doctalk show.
Welcome back from that short break. The Doctalk show is continuing. And for about 15 years now, the country has embarked on a collaboration with the New York University to tackle hearing loss. And Makerere has led a campaign. And what happens when Professor Roland Thomas and Professor Sean McManamy come here to spend a week in the country? What happens during that week at Makerere, the rest of the country? Tell us, Chris.
Of course, lots of things happen. We're a training institution, they're a training institution. And this started a long time ago. Wow. I think I was still a first year resident. So many things have evolved. And this happens twice a year. It used to happen initially we used to have about 10 days in the beginning of the year and towards the end of the year. But then we cut it to a week of training. So typically on a Monday, we go for lectures, which we run from morning to around the afternoon hours, and then we end up in examining patients. It's good for people to share the way we examine patients. We don't examine patients the same way, you know. It's good to know how Professor Roland does. It's good to know how. So our residents and our young students interact and see how people talk to each other and see how people examine each other. So that is a typical
So the
day.
team comes to impart knowledge.
Knowledge.
Pass on knowledge to our
Yes.
doctors, the future doctors, and those in training, and the other specialists to get the skill of combating hearing loss. How has the experience been, Professor Roland?
Well, it's been fantastic. The overarching concept is just building capacity, and the best way to build capacity is to teach and train and assist the young doctors to gain the knowledge that we have, and we do this, as Dr. Chris mentioned, through lectures, through one-on-one interactions with interesting patients and patient problems, discussing how we'll manage the patient. We do surgeries together. It's not really about me coming in and doing surgeries. It's about me coming in and Dr. Menmi coming in and assisting their team doing the surgeries. Many of the surgeries the team does, and we're just there to provide support and assistance and make sure everything goes as well as it can possibly go. We also have a cadaver lab. A lot of ear surgery is learned operating on with similar instruments on cadavers. And so we practice the procedures that are done. We learn the anatomy of the ear, we learn how the ear works, how it functions, what diseases affect the ear, and what we can do to prevent those diseases or treat those diseases. So overall, it's been a wonderful experience. You know, initially it started as a curiosity for me, and it evolved into almost a passion and interest. And it's also very much about friendships. We've established wonderful friends and relationships, and it's about not letting your friends down and supporting them. And each time we come, we have a goal. You know, recently our goal has been raising awareness, and you're helping with that. Thank you. And then I would bring in another friend like Dr. McManamy, who's a partner and a friend for many years. We've known each other for more than 25 years. And one day I said, "How would you like to come to Uganda with me?" And he said, "Sure." And I think
down he came.
And he's hooked. This is his fourth visit already.
Thank you, Professor McManamy. How has it been impacting on the lives of the patients in whom you've participated, getting back their hearing, and the residents that you've trained to acquire the skill to be able to help others?
Well, as Dr. Rowland said, our goal is to help.
And we are very grateful. Thank you. Chris, you're training local doctors to take care of Ugandans. How is the fellowship program going on?
Actually, the fellowship has been going on because we have been exchanging students, okay, and specialists who go to New York and have weeks or months there, see what goes on, see how their labs look like, operate, observe in the surgeries, and carry out do lab work at New York, and then they come back. That can happen almost yearly. Somebody has been going to do that. What we want now is to have a formal kind of training that we put on the market for other Ugandan doctors, maybe someone else, because Makerere is a big institution. We don't have to have only Ugandans having this training. Some people could be interested and they're from elsewhere. So we want to formalize it and make sure this works out.
There are not so many centers that provide care for those that have hearing loss. And I want to ask Chris, what are the numbers like at Mulago? A typical day, how many patients have to come and see you because they have hearing problems? Are the lower health centers, health center 2, 3, the district hospitals, are they equipped? Are they helped enough?
Let's put it at the big perspective of the country. If you moved around, and I know, Dr. Ogavu, you've been moving around, and you are very much aware that hearing per se and hearing tests are not being done in the country. So thank you for letting us go on TV and talk about it. Maybe this is going to raise awareness. You know, in the first segment I said, this is the tip of the iceberg. Not all hospitals can do tests. And not all regional referral hospitals can handle this. But since we have started talking about it, and people are listening, I know the policymakers are listening, and they know that a few things need to be put in place. So hopefully in the next few months or years, we shall have a broad, well-laid program for hearing. I am very aware that the ministry is deeply involved in hearing and has issued statements, but we have not yet, or they have not yet put it in practice. But I am aware that that has been done. On a daily basis, 3 or 4, actually when you sit in an ENT clinic, about 6 or 7 patients out of 10, 3 of them will come with a hearing problem. So 30% of every 10 patients you're seeing have a hearing problem. It may be mild, may be severe, may be profound. It may be easily done in the clinic, or it may need rehabilitation, or need surgical intervention. So it is a broad spectrum stuff. Does that?
Thank you, Chris.
Sorry.
As you heard,
going on?
30% of the patients that go to see an ENT
In a
doctor,
daily clinic, like
yes,
a day
have
clinic.
a problem with their hearing. So we need the training, and we are very grateful to the team that is going to empower us to train our own people and be able to reach out to everyone. As you go for the break, don't forget to subscribe to our YouTube channel. Don't forget to follow us on Twitter and like our Facebook page. We are getting responses and we are liking the interaction.
You are watching the Doctalk Show.